identification. None of those barriers exist in the county jail. None of them. So we have a significant population that we can do more to help, and we are. And it's the brilliant people that are here today that deserve all of the credit. There are no barriers in jail, and if we do what we can do for those that are in jail, I like to think of them as a captive audience. Then we can move forward from that and also provide services for them in the community. We call this the STAR program, Substance Treatment, Advocacy, Recovery, and Reentry. Two very strong forces have now combined after a vision by Joy Johnson, our Director of Health and Human Services for the county. Helping Hands, and also our Tri-County CEO, Bob Reinhardt. But I want to take you back. Dr. McMicken, who was my personal physician for many years, he's since passed away, called me one afternoon and he says, Grady, we've been talking about a program. Mary Beth Moore and I have talked, and the team has talked, and we think we can do more with mental health services in the jail. And I said, Dr. McMicken, I could only dream about that. That's what we've always wanted. And that's where Helping Hands started. So Dr. McMicken has passed now, but he'll forever be one of my heroes, because even though he's not with us any longer, he is still doctoring people because of his wisdom. So Helping Hands not only has Polk Health and Human Services and the Sheriff's Office, but Polk County Fire Rescue, Yes Care, Tri-County, Winter Haven Hospital, Lakeland Regional, Peace River, Core Behavioral Health, Florida Department of Corrections, Probation and Parole, and County Probation, and now JASA, our in-jail substance abuse treatment program. I've got some other notes, but first I would like to introduce to you our chairman, Commissioner Braswell. Commissioner Braswell is a leader. One of the biggest challenges to any program is funding. And our Board of County Commissioners said, yes, we'll help. Yes, we'll make a difference. And at the end of this program, I'm going to vision for what one of our next steps will be. And it was because of our chairman and our county commissioner, Braswell, leading the charge and our other commissioners supporting so that we can make a positive difference in our community. Chairman?
Thank you, Sheriff. I've got a statement I want to read, but before I do that, the one thing the Sheriff said, in the 7 years I've been in government, the one thing I've noticed are silos. There's so much information that doesn't get moved back and forth. Just the idea of moving forward and knocking those down, better communication, I think will help everybody in this situation. But I do have this. The vision of Dr. Thomas McMicken of providing services to incarcerated individuals who needed additional support for behavioral health or an addiction was realized in the creation of Helping Hands. Since its inception in 2018, the program is focused on its core tenets: healthcare, access, navigation, delivery, and support. Helping Hands, a nationally recognized program, serves as an umbrella framework for many programs that support both incarcerated individuals and those re-entering society post-incarceration for up to 12 months. The programs include Hatch, STAR, and Second Chance medication-assisted treatment. These expanded programs combine to support these vulnerable residents in their transition from incarceration to active and contributing members of our society. A multidisciplinary team approach brings partners together in an innovative way to identify participants and assist them in connecting with behavioral health providers, resources for recovery support, medications, case management, health assessments, transportation, and housing. This team is made up of community paramedics, certified peer specialists, case managers, housing specialists, to name a few. Overall, this program has seen many successes that have changed the trajectory of those individuals recycling through the criminal justice system. It not only impacts the individuals, but it also positively affects their families, their neighbors, and our community. Thank you.
Thank you, Mr. Chairman. And next, I'm going to invite Tri-County CEO Bob Ryan to speak. Bob and I go back many, many years with the JASA program and the work that we've done. And once again, you can't measure the absence of an event. So when you look at all the people that all of these folks represent that we've helped in the community, what you don't see is the ones that they've helped that have stayed out of trouble, that have put their life back together, or that never got into trouble because they were there. These are the masterful people, and this is one more example. Bob, come up and speak with us.
Thank you. Hi, I'm Bob Ryan with a giant heart. Thank you very much, Mr. Sheriff. In Polk County, I saw that there was very little being done. But when this sheriff was elected, slowly but surely, the events to bring us to this day have occurred. The JASA program is over 30 years old. Evaluations in the jail is another piece that was going on during the sheriff's tenure. And as we continued on, the services that we delivered started to prove itself in non-recidivism to the jail. So with that captured, the JASA program was instrumental in educating individuals here in the jail, or at each jail now. And that meant that individuals were no longer recidivating in the manner that we have seen in the past. Consequently, Tri-County continues to be a full supporter of the programs that are being shared here today and that have continued from the past to today. We are really happy to be partners with Peace River and the crisis response team that is in every sheriff's office. For that is the prevention piece relative to people coming into the jail. And if they get past that point, then they come to the jail, and we work with the folks in the jail from a mental health perspective now as well as the substance use. Then the path continues through a program called Helping Hands. And Helping Hands has been an extremely successful program in helping individuals move through services in the community that are waiting for them to be obtained. So I thank the Sheriff's Office, Mr. Sheriff, the county, for having made this possible. And you too, Joy, wherever you stand here. I know you're here. So thank you very much, and that's about all I have to say. Thank you.
I want to list to make sure we do the supplemental or additional stakeholders that have agreed to provide services and have agreed to help us. And once again, if you're from the outside looking in and you see these folks here, you go, well, there's a lot of nice folks standing up there. But you can't understand the energy that I have, and that's why I repeat it, that this is the first time that we've all been in the boat with an oar in our hand, rowing in the same direction. Heart for Winter Haven, Heartland for Children and Neighbor to Family, NAMI, Peer Specialist Training, to name a few. Now I'd like to introduce you to Denise Harrison, who has worked with Tri-County for 18 years, and she's currently a community program coordinator working in the STAR program. She just happens to be a peer specialist. She is the subject matter expert. And from what I understand and my interaction, an absolutely great one at that, who has worked in our jails for years and years and years. I'd like for you, if you will, to share your story and the vital role of peer specialists in your recovery efforts. Denise?
Hi, guys. Denise Harrison with Tri-County. We're in such a different time than used to. If you had a mental health condition or a substance abuse disorder, it was a dirty little secret that nobody talked about. Now I'm asking people to put it on their resumes. So we've come a long way with that. But the biggest part about the peer specialist role, we talk their language. We ran the same streets. We've been to the same jailhouse. We've been to hell. We know the way out. And from the beginning conversation with these individuals, what we're asking them is, what is your idea of success? What do you want to accomplish? What do you want to do? And then from there, we develop a plan and we hold them accountable. So how we're able to go across agency lines with releases of information, of course, is we follow them to their doctor's appointments. If they're having a problem communicating with their doctors, we help with that. We take them to 12-step meetings. We take them to the grocery store if they're not capable of doing that on their own, until we get their strength built up and their belief in themselves built up to where they can handle it on their own. One of the great things about Tri-County is we never have a wrong door policy. If you're a client of mine, you're a client of mine forever. And if you ever need us, we're here for you. And with that need, Jersey Commons is a subsidized housing unit being built by Tri-County in Winter Haven. That was going to help our high-need, high-utilizers, say those people who can't just get a grip. You know, the mental health is too strong. Social Security doesn't pay enough to sustain rents in the area. So what do these people do? And what we do is we get them over to a subsidized housing to where they can receive the case management services, peer support, and basic health care. So I'm excited to be with this. I love working with the Sheriff's Office. They have been more than accommodating with anything that we've tried to introduce the inmates to. I have not been told absolutely